Hi, everyone. Good evening. We're so excited to have this opportunity to learn together tonight. I'm Dena. I'm the Yoetzet Halacha in Stamford, Connecticut. And I also work for Nishmat Miriam Glaubeck Center. And here with me tonight is...
Hi, I am Elissa Hellman. I am a OBGYN. I practice in Milwaukee, Wisconsin, and I've been doing this for about 10 years or so. And I also have a telemedicine practice kind of focused on like kind of the unique GYN needs that the woman who practices Taharat HaMishpacha or plans on it kind of has sometimes. So a good way to address some of those concerns.
Okay, awesome. So we're here tonight to discuss Mikveh with a medical challenge. We're going to spend most of our time talking about chatzitza questions, barriers to immersion, and different medical situations that present questions of possible barriers to immersion and how to handle those situations. So we're going to outline some of the principles and discuss how they would apply in different cases. So I'll just start off with a very common, relatively common scenario, a question that we get a lot. And the question is from someone, or, not necessarily this exact scenario isn't so common, but, versions of this. So the question is, I just had my gallbladder removed and the surgeons used Dermabond instead of stitches. I have glue residue on my stomach, not just between the approximating skin. Is the glue on my skin a chatzitza, a barrier to immersion? If that glue comes off before the mikveh time, is the glue holding the wound together, the wound closed, the potential chatzitza as well? So this is a common question that comes up about someone who had a procedure or had an injury, has stitches, Dermabond, something like that, and how we address that with mikveh. So we're going to outline some of the principles behind what we would need to consider to address this question, and then we'll address some specific scenarios. So
Sounds good.
Yeah. I wasn't sure if you were... Okay.
Yep, I said sounds good.
Okay, awesome. So to start off, I'm going to share my screen and we'll look at some sources. So let's do that here. Okay. So we're going to look at the first source here. We're going to look at some sources that tell us what's actually required when a woman or anyone who immerses, right? Other people in halacha also are required to immerse in the mikveh. That's not so practically relevant nowadays without a beit hamikdash, but so we'll talk about women for our purposes. So when a woman who's a nida immerses in the mikveh, there are two requirements, right? The first one comes from source number 1, which is the Sifra, the Midrash Halacha in Vayikra, that tells us that when a woman immerses in the mikveh, she has to be completely submerged. All of her body has to be under at the same time. You can't dunk in the mikveh with your arm out and then kind of put your arm in and say, okay, now water got over my whole body, I'm good. But you have to be completely submerged all at the same time, right? This source says, just as the sun sets, right? When the sun sets in terms of the days that the person's counting toward becoming tahor, that happens all at once at the sun sets. So too, the mikveh immersion has to be all at the same time. That's principle number 1, is that you have to be completely submerged all at the same time. And the requirement number 2 for mikveh immersion comes from source number 2, which is a Gemara in Masachet Eruvin, that tells us that Amar Rabbi Chia bar Ashi Amar Rab, and you can also follow along in English, that shirin, chatzitzin, and mechitzin halacha l'musha misinai. So there are certain categories within halacha that are traditions that we have from Moshe at Har Sinai, and one of them is chatzitzin, right? One of them is this concept of barriers to immersion. And the Gemara continues on. I'm not going to read the whole thing inside, but says, tells us that we are required to not have any barriers to immersion on us while immersing in the mikveh. So we have to be completely submerged all at the same time with no barriers between our body and the water. Okay, so those are the two requirements. Now, which areas of our body are required to actually have water reach them and not have any barriers between that area of the body and the water? So that comes from source number 3. Source number 3 is the Gemara Nida that tells us, right? Certain cavities or like hidden areas in the body don't need to have water reach them. Right? They don't need water to actually reach them, but they need to be a place that water could possibly reach. Okay, so what this tells us is there's kind of like 3 layers within our bodies, right? There's that part of our body that's completely internal, that's completely not exposed at all, right? Like inside of our body. Water does not have to reach there. Water does not have to have the ability to reach there. We don't need to clean there. We don't need to take anything out. Then there's parts of our body that are that are exposed, right, the outside of our body, where water has to be able to get to, and we need to remove any barriers from that area. And then there's parts of our body that are cavities, right, that are sometimes exposed, sometimes not exposed, like let's say the inside of our mouth or the inside of our eyes, right? Sometimes our eyes are open, sometimes they're closed. And water, we don't have to actually go in the mikvah with our mouths or eyes open, but we have to clean them out such that if they were to be open, water will be able to reach those places. Those are called the Beit HaStarim and Beit HaKmatim. So I'm going to stop my share now, and I'm going to turn it over to you, Dr. Hellman, to tell us a little bit about some contraceptives in terms of like where they are in different places in the body and what, possible chatzitza issues that those might present based on what we just discussed in terms of different areas of the body that chatzitza may or may not be a problem.
Right. All right. Do you have that slide? Or are we just talk? Okay.
Okay. Here we go.
All right. So, there's a lot of different types of birth controls. And aside from just the kind of original, beginning type of oral contraceptive pill that people were taking, like they've been able to formulate a lot of different types of birth controls. So that are not, you don't need to swallow them. So the first one we'll talk about is the IUD, which is an intrauterine device. And you can kind of see the picture here off to the left. It's inside the uterus. There's a little string that hangs right outside of the cervix, which is kind of dangling into the vagina. And this is like well within the uterus, right? So water is not real. That's like, that would count probably as the first category that Dena mentioned, where it's literally internal. There's no, like, water does not have to go up inside your cervix and into your uterus, because that is an internal organ. The string that hangs outside of the cervix into the vagina really only hangs out just a couple of centimeters, and you have to see it. So there's no real way to get rid of it. The purpose of it is to be able to just pull on it to remove it when you want the IUD out. So as far as my understanding goes, this is not a problem for as a chatzitza in the mikvah. Am I correct, Dena? Okay.
Yes.
Okay.
It would not be a problem.
Okay. So then there are other, well, you know what? Do you mind flipping to the NuvaRing slide? I think it may be the next one. Next one. Oh, it was number 2 or 3. Sorry. Preview of everything. Perfect. Yes. So then we'll also go to the hormonal vaginal ring. So I'm just trying to go from like deep inside the body to further out. So then there's also something called the NuvaRing and Anovera. So what these are kind of little really flexible, kind of plasticky, rubbery feel rings that have a hormone in it, and it gets absorbed through the lining of the vagina, which is actually very similar to the lining of the mouth. So it's a really great place for hormones to get absorbed through. So this is something that you put in and take out on a monthly basis, and you control it. So you have access to it because it sits like right where a tampon would sit. So it's easily removable and insertable on your own. Now, when a woman goes to the mikvah, she is usually finishing up or close to or around the end of the second week of her cycle. And because she's finished her period, she would have put a new ring in already at the point that she is finished with her Sheva Nekiyim. So this is definitely the mikvah night would definitely be a time of her cycle where it would be in her. However, the hormone level that gets absorbed, it doesn't need to be in there 100% of the time. The contraceptive effect will still be there if it is removed for a few hours even. So assuming it doesn't take a few hours to dip in the mikveh, this probably could be one of the last things you remove before you actually go in. Just clean your hands afterwards and go in. And it is okay that it is out for that, I guess, 5 to 20 minutes or however long it takes to go in the mikveh. So it is okay to remove it. Did you want to comment on, Dena, what happens if you forget to remove it?
Sure. So, maybe it will come. I can come back to the maneuvering a little bit later when we address some other when we lay out some more principles in terms of why it is ideal to remove it. Meaning, right now we're saying that because it's in an area of the body that's sort of like a cavity, right? It's the middle area where it's not completely internal, so it is possible to remove and therefore ideal to remove. And when we lay out a couple more principles, I will definitely come back and address why.
I jump ahead sometimes, so yes, please stop. Okay, then so there's one other type of vaginal hormonal ring called anovera. That is a ring that is similar to the Nuva ring, but it is one ring you keep for the whole year. So it's in you for 3 weeks, out for a week. So that, for sure not a problem to take out and in because it's meant for that. Nuva ring is also fine to remove and replace, but it's a new ring every month. And then I kind of included the pessaries in this slide because it goes in the same place. A pessary is something that sits in the vagina to help hold up someone's prolapsed pelvic organs. So either the bladder or the cervix and uterus could be kind of falling down, causing some discomfort, and a nice little plastic disc. And you can see that there's pictures of some other shapes. And that is also something that goes up inside. Generally, the only reason I kind of put these slides together is because of where it goes. Generally, I also put this to be more inclusive. Most people wearing these are menopausal. This is usually more of a menopausal type concern, medical issue. So most people with a pessary probably are not even going to mikveh anymore. So it is definitely something that is probably not a frequent question. It is also somewhat difficult to remove these on your own. So it may be something to kind of think about if for any reason you do have your uterus and you have one of these in, to kind of talked with your doctor, and we'll kind of talk about that later. But overall, they are difficult to remove on your own, which is different from the hormonal vaginal rings. If we go back to the slide before, just to kind of go over the transdermal patches. So these are birth control patches, and there's 2 types of them. One is called Xulane and one is called Torla. And these are hormonal patches that there's a few types. The Xulane and Torla are actually birth contraceptives. So they are a new patch you put on every week. And you put them, you can kind of see that little diagram there of the different areas on your body that you can put them in or put them on. And it's an adhesive. It's basically a sticker that kind of sticks nicely, and you just replace it every week. Again, because you're usually going to the mikveh towards the end of your second week or towards the end of the first week of your cycle, you have one of these on, right? You're definitely at a point in your cycle of hormonal contraception that you are needing to have it get absorbed. These are a little bit more difficult to play around with because if you stick it on and then you have to go to the mikveh a day later and you take it off, this one, it's hard to stick back on. It made the adhesive doesn't work as well. If you try to put a Band-Aid on again, it's gonna not stick as well. That second time you're putting on the adhesive is not going to be as strong. And we want to make sure you're absorbing the hormone, right? That's the point of it. We don't want it to be all of a sudden become ineffective contraception for you if that's what you want. So that, again, we'll discuss the halacha with that. And then there are also other types of hormonal patches specifically for hormone replacement therapy. And this, again, would be more relevant for a woman potentially going through kind of perimenopause or menopausal symptoms and side effects that a little bit of estrogen would help relieve those symptoms. So again, most of the time a woman is not menstruating at that point, and mikvah would be less of an issue. But again, sometimes people will be on an estrogen patch like as they're really at the tail end of their period life and may have a few periods here and there where they would have to go to the mikveh after and still be using these patches. Those patches are usually like a once a week or a twice a week dosing. And it's important to understand the dosing of it when it comes to, wondering like, hey, how is my mikveh day going to match up with where I am in the dose of this thing I'm putting in me or on me?
Okay. So, so that definitely gives us a lot of insight as to certain things that go sort of in different layers, so to speak, of our bodies. And some of those things are definitely not chatzitza issues at all, like we established, and some might be. And we're going to outline some more principles, which will help us understand whether those, let's say like the patch, whether it would need to be removed or wouldn't be, and how that works, and the maneuvering. So, so I want to discuss now to kind of bring us, to that next step is. How do we actually define chatzitza, right? We defined already where in the body chatzitza wouldn't be a problem, but how do we actually define what a chatzitza is? So let's go back to our sources here. Here we go. Okay, so we're up to source number 4 here. And source number 4 is the Gemara also in Eruvin that tells us that there are 3 levels of chatzitza, right? Rabbi Yitzchak says, Rabbi Yitzchak Dvar Torah Rubo Makpid Alav Chotzitz, right? So there are 3 levels of chatzitza, which we're going to see in a second. And there are 2 issues that kind of get addressed when we're defining whether something's a chatzitza or not. So 3 levels, 2 issues, right? The issues that the criteria that we want to address are whether how much of a person's body does the chatzitza cover, does it block, right? And also, does the person care that it's there? Do they want it there, or do they plan to remove it? Okay, so Rabbi Yitzchak says, Dvar Torah rubo makpid alav chotzitz v'she'eno makpid alav eno chotzitz, right? Midoraita, on a Torah level, something that covers the majority of the body, and the person does not want it there and they plan to remove it, that would be a chatzitza. And if they don't plan to remove it, or it doesn't cover the majority of their body, then it's not a Torah level chatzitza, right? The gazru al rubo she'eno makpid mishum rubo hamakpid al miuto makpid mishum rubo hamakpid. So on a rabbinic level, we have the either or categories, right? If you have something that covers the majority of the body, but is something that the person wants there and they don't plan to remove, or more commonly, something that doesn't cover the majority of the body, but the person would prefer it's not there and they do plan to remove it, which are most chatzitza questions that come up, right? Most chatzitza questions don't cover our entire, or even the majority of our body. They cover a smaller area, but we would prefer for the thing not to be there. We do plan to remove it. So those would be rabbinic level chatzitzas. And then the Gemara tells us that the 3rd level is a miut she'eno makpid, right? Something that doesn't cover the majority of the body, and also the person does not plan to remove it. They want it there. They don't mind it being there. They're not bothered by it being there. And that is not considered a chatzitza technically at all. However, if we look at source 5, which is the Shulchan Aruch, right, the Code of Jewish Law, codifying what we just saw in the Gemara and Eruvin, source 5 tells us, summarizing everything that we said in the first 4 sources first, right, that you have to submerge your entire body at once, right, tzricha shetifol kol gufa b'pam achat, lefikach tzarich shelo yeh shum davar chotzitz, right, therefore you can't have any chatzitzas, the 2 requirements we outlined. And then it goes through the levels of chatzitza that we just discussed. And then the Ramah, who's the Ashkenazi gloss on the Shulchan Aruch, right, telling us Ashkenazic practice, says, ideally, someone should not go in the mikvah with things that are technically not a chatzitza, right, that 3rd category of things that are, don't cover the majority of the body and you don't mind them being there, right, which is sort of like a protection in place so that you don't end up going in the mikvah with something that is actually a chatzitza. Okay, so our custom in a typical situation on a regular basis is that we remove everything, right? We remove contact lenses and jewelry and clothing and our glasses and our ponytail holders and everything, right? We take off everything. That's our common practice going into the mikvah. We just remove all possible barriers. We go in completely with nothing on us. However, right, when these levels of chatzitza do actually come up, or when we face situations where it's difficult to remove something, or it's impossible to remove something, or if someone realizes after they went to the mikvah that they accidentally went in with something on, whether they have to go back again, that's not our topic for now. But our topic for tonight is what happens if it's difficult to remove something or impossible. then we have to figure out, well, which of these levels does our case fit into, and therefore is the person allowed to go with that thing on or not? So we're going to define, first of all, we're going to define what does it mean for someone to plan to remove something, right? So in source number 6, we have an important principle that's taught to us by the Ravid. The Ravid was a Rishon from Provence, very medieval commentary from Provence, and he says in his book about Nida, he says that we don't, when we define plan to remove, we don't mean that like you plan that like as long as you right, he says don't say that because like you don't plan to remove, because you plan to remove it for going in the mikveh, but you sorry, let me just read it. It's a low tema kol she'enu makpid alav b'shar hatzvila ela im takpid alav shar achat devar hamakpid alav, right? It's not like, oh, just because you plan to remove it for mikveh, but you sorry, it's not like the person could say to themselves, oh, but I don't mind if it's on me for mikveh, so therefore it's not considered something that I plan to remove. If the person at any point in their routine, their daily routine, like doesn't want that thing on them, or they don't have it on them all the time, and they don't wear it all the time, and sometimes they do plan to remove it over the course of their daily, weekly routine, and that would be considered something that they plan to remove, right? So just because, let's say he gives the examples of rings, right? So just because you wouldn't mind going in the mikveh with your ring on, if you take your ring off to knead dough, right, he says, then that's considered something that you do remove periodically, and it would be considered something that you do plan to remove. Okay, so that's kind of a general definition of what it means to be makpid on something, right? To plan to remove something and be bothered that it's there. But now let's get into a little bit more detail about how we define that in the face of a medical situation. So if we look at source number 7 here, which is from the Noda Yehuda, who's a leader, right, like 1700s rabbinic authority, and this is his responsa, Rabbi Chazkel Landau. So he talks actually about a pessary, right, which Dr. Hellman mentioned a few minutes ago, right? And so pessary is already been around for a very long time, right? It's not an invention of modern technology and modern medicine. And so he says if a woman has a medical condition, I'm reading in the English, who needs a ring of wax inserted deeply into her cervix for medical reasons to keep the uterus from prolapsing and falling out, that would be the pessary. So that's the case that he's talking about. And further, even if it's considered that she's particular, so even if it is, even if we would define it as her being makpid about it, right? She like would prefer that it wasn't there, in the sense that like she'd prefer she didn't have this problem of a prolapsed uterus and that she didn't have to have the pessary. It's still a small thing, right? It doesn't cover the majority of her body, but she is particular about it, right? She's makpid about it. Therefore, it's a rabbinic level chatzitza, right? So he categorizes this into category 2, right? That it's a rabbinic prohibition that doesn't cover the majority of her body, but it's something that she would rather not be there. But he says this is going to be the really important part for our purposes. And in a case when there's no option, right here, this is an extenuating circumstance. She doesn't have the option to just like remove it for mikveh, like Dr. Hellman said. It's difficult to remove. A woman can't remove it on her own. It could be dangerous for her to remove. And in a case, so there's not really like a good alternative for her. So he says, the Noda Yehuda says we can treat her using the Torah level standard. So we can rely on the fact that it's at a Torah level chatzitza and allow her to immerse with it. Okay, so one principle that we're establishing here is that in a situation where there, it's an extenuating circumstance, we can possibly be more lenient. So that's number 1. Number 2, here we have another responsa from Rabbi Akiva Eger, also a late, not post-medieval commentary, modern times. And he says, also talking about a pessary, right? He gives the situation of a pessary, and he says, I'll read the underlined part here, which is in the English, if you want to follow along, it's the second paragraph here. He says, if someone's in a dangerous situation, they're certainly not going to endanger their lives. There's a woman certainly not going to endanger her life, and therefore she's not going to take it out. So therefore, it's considered that she's not makped on it. She's not particular about it. She doesn't plan to remove it, right? Because in this situation, like, does need the pessary there, and it's there for a medical reason. There's a need for it to be there, and therefore she does not plan to remove it. She does want it there. So even though, yes, in theory, in the bigger picture of life, she'd rather not be in a situation where she needs a pessary, but she is in that situation, and therefore she does need it, and she does not plan to remove it. So it's considered that she wants it there. And therefore, Rabbi Akiva Eger would say it's in category 3, right? That it's not actually a chatzitza because it doesn't cover the majority of her body, and she does not want to remove it. so she would be allowed to go with it. Okay, so those are some principles, kind of baseline principles that are going to become important to apply in different medical situations. Okay, so those response that we're both talking about cases of a pessary, which is sort of like a more permanent long-term thing, but that is medically necessary, and therefore because it's medically necessary, maybe we can treat it as something that she does not plan to remove, or according to the Nodes of Yehuda, the first source that we saw in number 7, he doesn't necessarily agree with that, but he says since it's an extenuating circumstance, we can be more lenient. Okay, so let's talk about another issue. There are certain cases, and I'm going to turn back over to Dr. Hellman in a minute, where something might seem like a barrier, but really water can actually get underneath it. So we have a Mishnah here in Mikvos, right? The Masechet that talks about Mikveh, in number 9, that tells us that the following things block immersion in the case of a person, right? If you have a person going into the mikveh, right? This would be as opposed to pots, pans, things like that, that we would put in the Kallah mikveh. So if you have threads of wool, threads of flax, the ribbons on the heads of girls, those things would be considered things that block immersion, right? That would be barriers. Rabbi Yehuda says those of wool or of hair do not interpose because water enters through them. So Rabbi Yehuda says, no, there's these certain things that the Mishnah is describing actually are not considered things that block the water. They're not considered chatzitzas because water could actually get through them, pass through the material, and touch the body. Okay, and the Tur, who's a code of Jewish law that preceded the Shulchan Aruch, he brings this down halacha masa, right? He says bracelets and rings and hair pieces on her, if they are loose, they do not block immersion, right? If there are things that are tied loosely that water can get underneath, they would not be considered that they are a barrier to immersion. If they're stuck tightly, then they do block immersion, and the same would be true with a bandage on a wound and straw on a break, right? Like an area that an area of the eye that's broken, like a bone. So a similar concept, right, that he's bringing down here, where he says if water can get underneath, then it's not a problem to go in the mikveh with it. Now, I just want to clarify again, our custom in a regular, typical non-medical issue situation is to remove everything. So we don't go in with things that water can get underneath, because our custom is to remove everything, even things that are not technically chatzitza. But when you face a situation of a medical challenge and water is able to get underneath the thing that you're dealing with, so that is definitely a way to deal with that situation. So I'm going to turn it over to Dr. Hellman now to talk a little bit about things, common medical things that water can get under, or sometimes that it can't, specifically about casts. Okay. So I will put on your slide.
All right, so let's just keep in mind that I'm not an orthopedist. I am a gynecologist, but I will kind of say whatever I know about these. So there's, when someone has like an orthopedic injury, which basically means, they have a fracture in their bone, or they had surgery on their bones, or they need some type of immobilization, right? That is the purpose of these casts and these braces. Many times these injuries are severe enough that either require surgery or require a long period of time of immobilization, which allows the bones to heal, any potential ligaments or tendons that have been cut or severed that need to really heal together. And the nature of those tissues themselves is it takes a while to heal, right? It's not like a little paper cut or a little skin cut that you get that in 2 days it's like closed. These take weeks to heal. So, there's different types of casts and braces that can be put on based on, like, I guess the how like strict you need to be about that immobilization. So for sure, if you have a break in your bone, you're going to need a cast. Well, if it's on an arm or a leg, right? You can't. Kind of hard to cast anything else. So there's 2 types of casts. One is like kind of the older, more traditional type called a plaster cast. These cannot get wet. The plaster itself will start to kind of break down and get a little bit mushy, and the cast itself will get ruined. They do have, like how does someone take a shower for a month or 6 weeks? They do have like little waterproof, like take a rubber band, put a bag around it. They have like special little waterproof things you can use. But these overall should definitely not be completely submerged in water. So no swimming, no pools, like cover it when you're in the shower. As far as, so most of the casts that we actually use today, especially like, I'm sure you've seen kids or had your own kids kind of break their arms or their legs, is something called a fiberglass cast, and those come in lots of different colors, like the one here. And the way it's done is there's a little gauze, or kind of like almost like an ace bandage, like a thin ace bandage material kind of sleeve that goes over the limb first, and then this fiberglass, in whatever color you want, is wrapped around it, and it hardens and it sets. And these are waterproof. So if you've seen kids swim in them, you can take a shower with them without having to cover them. And they don't lose their shape because they've hardened in that area, like in that position that your arm or your leg was set in. When it gets wet, because there's fabric underneath there, and that's really just a protective layer so that the actual cast material is not touching your skin. With sweat and with water, it gets kind of gunky and smelly. But it's not a problem to submerge it. It may not like smell great 6 weeks later, but it's definitely something that is okay to get wet and will not damage the actual cast. And then there's other, braces that are removable, right? Like the boot here, that you have the arm splints, and there may be other types of braces for fractures or things that need healing if you've had surgery on them, that are in other parts of the body, like a back brace or something to kind of keep your shoulders more immobilized, depending on where you had surgery. So anything like with Velcro on it, and they typically have Velcro to kind of make them tight and immobilize the body part. um, Obviously Velcro is removable. So like you can take them on and off. Some people will take them off specifically for a shower. It's not advised to go in the shower with them. They're not, I mean, they're waterproof and that you can just wipe them off, but they aren't really meant to be completely submerged. But they technically could be. But anything, if you have to wear something that has Velcro on it that is removable, it can probably be removed for 5 minutes, 10 minutes. And as long as you're at the point in your healing process, where you're not like fresh out of surgery and you are conscious of being able to just like hold that body part still and not do any like intense quick movements with it that may injure it if it's not ready for that, for less support around it. So those are probably going to be more able to be removed, as if we talk about mikveh purposes.
Okay.
Yeah.
Okay. So definitely if someone has a fiberglass cast, so they can get it wet, like you said, and that should not be a problem to go in the mikveh with. And, a cast that can't get wet is a problem, because you can't go in with it, then you would need to cover it up, right, in order to like take a bath or a shower, and then that cover is also a chatzitza.
Right.
So those are kind of difficult situations to navigate, depending on how long it needs to be on for.
Right.
Dr. Hellman, have you ever heard of a situation of, I know I heard of a story like this once where, a woman had to go to the mikveh who was going to have a cast on, not a fiberglass cast on, for a long time. And she was able to sort of find a doctor who was willing to like remove it for her to go to the mikveh and then put it back on. Have you ever heard of a situation like that?
I haven't, but that's a really nice doctor.
Yeah.
Yeah, I mean, and it's funny because sometimes, they will, like in the process of healing, if you want to make sure that the bone is setting properly and healing well, what they'll do is they'll actually like take an x-ray of the limb in the current cast and then be like, you know what, like we need to like move it a little bit, and so they'll take it off and recast it. So there are sometimes, depending on what the injury is, they will do it in stages. So if you can line that up with mikveh night, that would probably be ideal. Because you're at least halfway done with the healing process. So if it's without a cast for a night, they would probably give you like one of those Velcro ones to like sleep with and then go back the next day and get it put in if this is, something you can ask your doctor about. But I mean, it's possible, yeah. But I think you
Right.
have to find a doctor who's really like, oh yeah, sure, no problem. That may be hard to
Right.
find.
Right. I think this ties into something that I know we were going to talk about, in general, that it's like, excuse me, important to have these conversations with your medical professional in a way that is advocating for yourself and helping make sure that your doctor understands exactly like what your needs are in terms of halacha and really kind of explaining it in a clear way. So you're really kind of exploring what's really possible in a really broad sense.
Right.
I'm sure we could come back to that more later. But I also did want to circle back to the maneuvering now, because now that we addressed a couple more principles that apply here. So like we said, ideally we remove everything. And since, like you said, there's no problem with removing the maneuvering for a couple of minutes, right, it's not going to affect its efficacy. So we ideally remove the maneuvering. If someone forgets to remove their maneuvering for mikveh, and after the fact, when they get home, they realize, oh my gosh, I forgot to take it out. What do I do? Do I need to go back? So in that situation, they would consult with a halachic authority, with a rabbi or a Yoetzet or a halachic professional. But likely they'll be told, okay, after the fact, you don't need to go immerse again, because there's room for leniency, in the fact that it's sort of like in one of those internal cavities, right? It's not on the outside of the body, so that area is a little bit more lenient. And B, what we were just talking about, that since water, like, it's not kind of like stuck in place, right? Water can
flow around it. Yeah.
So that's another reason for leniency after the fact, even though ideally we would take it out. Okay, so let's talk a little bit about some more principles, and then we'll jump back to some more specific medical scenarios and cases. Okay, so the next really important principle to address, and I'll go back to my source sheet here. Bear with me while I get that up. Here we go. Okay, so the next principle is sort of how easy or hard or painful or not painful or dangerous or safe it is to remove something, right? And the more dangerous or painful or difficult it is for something to be removed, the more lenient we're going to be with it, right? Which is logical, right? And it says here in source number 11 and source number 12 that if it's something that's really necessary, that the person is going to be really afraid to take it off, and it's going to be dangerous for them to take it off, and it's painful to remove, we're not worried that they're going to try to remove it, then it's really considered something that's that they want there in a more significant way, and therefore will be more lenient with it. Okay, so that's another principle that comes into play. And then the next thing that I want to talk about is permanence, right? How long is the item on the woman, right? Because again, we're talking about this issue of hakpadah, planning to remove something, of not wanting it there, is one of the main issues that we need to evaluate. So when we say you don't want it there, like, how do we define that, right? Like, if it's on me now and I want it there for the next week, or I want it there for the next month, or I want it there for the next 6 months, or I want it there for the next year, even though it might come off after that, is that considered like I want it there now, so I can go in the mikveh with it now, right? How do we define that? So the first source on this is a very fundamental source by the Zichron Yosef. And he says that, right, he refers back to the Ravid that we saw earlier about the ring, right, who says, like, oh, if you have something that you sometimes remove, even if you wouldn't care if it was on for mikveh, if you sometimes remove it, and that's considered that you plan to remove it and it's not permanent and you don't want it there. So he says that's not the same as, let's say, a pessary, right? He's going also back to the pessary example. This is a common example that comes up in the Wisconsin literature. And he says that it's not the same, right? Because a pessary, like, you want it there, and he says, even though if a woman who's going to have a baby would take out the pessary when she's in labor, and I know you said it's not so common for younger women to have a pessary, he's talking about a woman who would be in labor would take out her pessary. That's not the same, because even though, like, at some point she'd take it out, he says it's right. It's not. He doesn't compare them, because he says it's different. Like the Ravid talking about the case of the ring is like, sometimes you take it off, sometimes you put it on, sometimes you take it off, sometimes you put it on. The case of, it's not sort of like at any specific time with any specific incident or episode or event, but that's when you're going to take it off. It's more just like come and go. right? But with the case of the pessary with the woman in labor, it's like she's going to have the pessary in all the time until some specific time, some specific event that she's going to take it out, and then she's going to put it back in probably after. Right? So he says that if there's like a specific time at which something's going to come off, but until then, like it's for sure going to be there, that in that time that it's for sure going to be there, it's considered permanent, and for that period of time, like she doesn't plan to remove it and should be able to go to the mikveh with it. Okay, so that's a really fundamental principle. Not everybody agrees with his interpretation, but Rav Moshe Feinstein in number 14, he's talking about dental work. He's talking about temporary fillings, and he says a few things. First, if someone has a temporary filling, right? Rav Moshe Feinstein is lenient that the woman can go to the mikveh with it, and he gives a few reasons why. He says, in the third paragraph here, he says, we should distinguish, like the author of the Zichron Yosef, and say his intention was to distinguish between someone being particular to remove a ring for kneading that doesn't happen at a set time and could arise any day or night, and therefore it's considered that she is particular about this item, because we can't say that's not the case at any particular time. Right? So if it's kind of just like whenever she happens to want to take it off, that means that she does plan to remove it. And we're going to distinguish between that and between a case when the person does not want to remove the item until a set time, and until that time, the item won't be removed. Right? So he says in the case of a temporary filling, right now you have the temporary filling in, and if the dentist said next week, a week from now, I'm going to put in the permanent filling, then until that time, you want the temporary filling in. You don't plan to remove it. So that is one basis for his being lenient about the temporary filling. And even if the dentist is going to put in the permanent one, not in a week, but in 2 days, Rav Moshe Feinstein would be lenient because, because until that time that you take it out, it's a fixed time, it's a set time. Until then, you want it there, you don't plan to remove it. So that's what he says. The Badei HaShulchan was another contemporary Halacha sefer in number 15, right? He says a little bit differently. He says that if something's not going to be there, and he's also talking about temporary fillings, but he says he wouldn't be lenient unless the thing is going to be there for 30 days or more from the time of the woman going to the mikveh. Right? If it's there for more than 30 days, then it could be considered permanent. But if it's going to be there for less than 30 days, then he feels like, well, you do plan to remove it. It's not permanent. And the Avnei Nezer, number 16, he talks about other people around him who brought up the idea of 7 days, that if it was there for more than 7 days, that would be considered permanent. But he was not comfortable being lenient on that. And he says that he once permitted a situation where something was there for 6 months, right, for half a year. So you see there's a real range of opinions here in terms of, how long does the thing have to be on in order to consider it that right now you want it there, you don't plan to remove it. So two other principles that Rav Moshe Feinstein raises here that also come up when applying certain medical, in applying the halacha to certain medical situations like dental work, like stitches, bandaging, steri strips, which we'll talk about in a minute. I want to raise two other principles, right, that he brings up, right? Number one is that he says that if the thing that you have, like he talks about a filling is like flush with the surface of the tooth, it's not protruding, it's not sticking out. So he says in that sense, it's not, he doesn't view it as a barrier. And that's another basis for leniency that he gives. And the third basis for leniency that he gives is that the area where the filling is blocking is never going to be exposed. It's going to be taken out and replaced with a permanent filling. So he doesn't consider it an area that actually needs water to get to it. Okay, so that's why Moshe Feinstein is lenient about temporary dental work, specifically temporary filling. But let's now take these. Let's now hear from Dr. Hellman a little bit about stitches, bandaging, steri strips, and dental work, and then we'll see like how we would apply these principles to those scenarios. So I will go back to the slides.
All right, so these we'll first kind of talk about how do we close skin when we cut it for surgery. So The reason that if we didn't close skin at all, the edges of the skin would eventually come together on their own. It would take a very, very, very long time. So that is why we use materials to bring the skin edges together so that the two sides are touching, which encourages healing much quicker. So there's a few different ways to do that. One is with staples, which are actual metal staples that are placed along the incision, which you can see on the first picture. Those are, of course, not dissolvable. They are metal. And depending on where they are on the surface of the body. Usually we remove them in about, like I say, 4 to 7 days after the procedure is done. And then after that time, the skin edges are usually together and incision has healed closed. The other way to put a incision together is using stitches. So there's a lot of different types of what's called suture material. The picture here is a type of material that is not dissolvable. So these stitches would need to individually be removed. And again, usually after about a week or so. And then there are other types of sutures that are dissolvable. The different materials have different lengths of time that it takes to dissolve. I'd say usually between 7 to 21 days. They're all dissolved. And there's also different ways to put them in, like the picture you see here, you're seeing the knots, you're seeing the edges that were cut, and those are sticking out of the skin, right? Sometimes we will actually use suture material and put the stitches under the skin so that when you're looking at the incision, like just on the outside of the body, you actually don't see the stitches because they're right underneath the skin. And those are dissolvable because we can't really access them very well to remove them. So that's what we would do for dissolvable stitches. And then the other way to close an incision is using some type of surgical glue. You probably have heard of the word Dermabond. That's kind of a famous brand of that. And so depending on where it is in the body and the amount of movement that body part is going to have. So like a knuckle or a knee or something that's much more rounded, that's going to have like more motion to it. Is not the best spot to put glue because it's going to like come off because of all that movement. So you're seeing a picture here actually of a neck. So someone had like a thyroid surgery and that, right, your neck doesn't like move around in that linear direction very much. So this is a good place to do it. And so they can either close the incision just with glue, or sometimes right underneath the skin, they put a few dissolvable stitches and then just kind of close the top layer of skin with glue. And it's nice because it kind of comes off on its own eventually, usually after about 7 days. Sometimes we'll see, like, as you've had it on for a few days, like the edges of the glue area kind of start to lift up or peel off. And that's just kind of like the natural process of the glue. But you don't want to rub too hard on it because then you could like irritate the incision a little bit. So you just kind of like let it fall off. Can we go to the next slide? Oh, go ahead.
Steri strips.
Yeah, that's, I think, on the next slide, maybe.
Sorry.
Yep. So once you have a closed incision or something, an injury that needs to be covered, there's different types of dressing. So the dressing on the first one, the pressure dressing. So this one is, and you can kind of see how the person is holding it down. So there's actually a lot of pressure on it. And this is a type of dressing that is used when an incision or an injury is just a little bit more bloody or oozy and needs to have pressure put on it to kind of help the clotting and healing process. The pressure is usually only needed for like the first 24 to 48 hours. And those are pretty important to not remove, I'd say for sure within the first 24 hours, because you're using that pressure. It's usually just like thick gauze with tape put down very tightly to put that pressure on it. And you're using that pressure to help the healing and the clotting process. Then like on the other side, the gauze bandage, and that can be really anywhere on the body. That's more of like a protection to just kind of something does need to have like some sort of leaking or oozing or bleeding, it adds a little bit of pressure, but also it's more of like a protective bandage so that it doesn't get injured or rubbed against stuff in your usual life. Steri strips, those are little kind of like just sticky strips that actually just help encourage the skin to stay together. There's always stitches underneath the skin there. So it's not like that's the only thing holding the skin together. Those are a little bit more liberals about when they can be removed. They're really just there for like help keeping the skin kind of like stable, especially this is a C-section incision right here. It is something that they have stitches underneath, and it just kind of with a lot of movement you're going to do, especially in the abdomen area. It just kind of helps so that you don't like the incision itself doesn't move around a lot. But they're just like they're almost like little band-aids. And then on a laparoscopic procedure where they use a little camera, you'll probably see steri strips or band-aids like that. And those, again, removable and replaceable if you need, like if you need to go in the mikveh, take them off, put a new one on when you're done. Oh, I think we only have 5 minutes left.
Okay, so should I go to the next slide?
Sure.
Okay.
All right. And this will just, again, not a dentist, gynecologist here. But so there's basically, I'd say like two big differences in dental appliances, right? One is removable, like an Invisalign, like braces, retainers after you have braces, dentures, or, partial dentures just to like fill teeth in. And those obviously you can take out, you clean, you put them back in. Those are for sure removable. You can be in the mikveh for 5 minutes without them. Things that are non-removable are things that are like cemented on you, like braces, crowns. They use a specific type of cement or glue to like, you can't take those off yourself. And implants, those are like screws, like once the tooth is dead, you put a screw in your jaw and then slip the fake tooth on top of it. So that is like in your bone. Like there's absolutely no way that you on your own and during your mikveh prep can remove them. So those are really the two categories of dental work. I think that may be it.
Okay, yeah, so I think kind of just to summarize how the principles we outline apply to these things, like things that are removable, again, like an Invisalign retainer,
Right.
dentures for sure remove, and things like a crown implant, like those are there forever. Braces are not there forever, and at some point they're going to be removed, but since they're there for like a pretty long period of time usually, and you don't remove them yourself and you need them there, so those would be fine.
Right. You know what? If you want to just go quick to the next slide, then I can finish up. I think we can probably apply the principles that you talked about to the diabetic stuff.
Yeah, let's talk about insulin.
Yeah. So very briefly, and this is common, especially for type 1 diabetics who need like a very tight control, and even type 2. But there's 2 types of monitors that go on your body, and not every diabetic has both of these or just one of them. But one is a continuous glucose monitor, and both of these are little like kind of electronic sensors that are attached to some tubing that then gets inserted under your skin. And the continuous glucose monitor constantly checks what the glucose level in your body so that you know like how much insulin you need or can kind of control, what type of foods you eat. And then your insulin pump is doing the same thing. It's like a little pager or a little pump that has the insulin in it. And again, connected to that little tubing that is injected. There's a little cannula that goes inside your skin to get that insulin in there. And the insulin pumps, usually those little cannula parts are replaced about every 3 days, and the continuous glucose monitor usually about every like 3 to 7 days, something like that. And so they are like the actual part that goes inside of you. You peel it off with an adhesive, you put a new one in, hook it up, and stick it back on. So if you potentially could like match up mikveh day with your removal, that would be ideal, right? Because you could probably be without it for 5 minutes. But if not, some people have issues with like, well, they only have a certain amount of supplies per month and insurance will pay for, and it's hard to sometimes kind of navigate that like supply issue with like, I can't just replace it whenever I feel like it. Like I'm on a strict schedule. So that's kind of the question that would come up between your doctor and I guess your Yoetzet or rabbi.
Right, for sure. So like you said, in a situation of financial hardships, if it's not possible to just kind of like take it off for mikvah, then it's definitely a conversation that's important to have, that we can, try to figure out what to do, whether it's, in certain situations pushing off mikvah by a day or two, or figuring out another solution. Those are definitely like important conversations to have. And that, I think that's a good way to wrap up this session by saying that really, like, chatzitza questions, almost more than anything else in Hilchot Nidal, though really everything are so case specific. Again, because of the principles that we outline in terms of like, well, what exactly is it there for, and how long does it need to be there, and so many of the issues that we've outlined are very case specific and depend on the exact scenario that the person is dealing with, and therefore it's so important to understand these principles so you know what questions to bring to the table, what
Right.
information to share in the conversation, but to really have conversation, have open dialogue, both with your halachic professional and your medical professional. Hopefully, everyone being in communication can really, get the best answer. So I know there was before we wrap up, there was a question in the chat that we can just address briefly. So the question was about a daith piercing, which has for
It's a great question.
For migraine relief. And it can't be taken out easily without going to a jeweler, and can't be put back in easily either. So
Right.
does that count as a medical device that you can go to mikveh with? So I'm going to stop this share. So I would say this is definitely like a case-specific question that I can't kind of give a bottom line answer to here in this forum. Right. I think we could try to apply the principles that we learned in terms of, can it be loosened? Could water, in terms of, I don't know exactly how what it looks like, but could water sort of possibly get
it's a little ring. Yeah. It's usually a little ring that kind of sits like right on the inside part of the ear, and that really like thick cartilage part. And that's just an acupressure point that some people, like when they have that constant pressure or that piercing in it, relieves the pain that they get from migraines. And you can't take that out in frequently. It's kind of painful. And it's like meant to be permanent because you need that constant acupressure point stimulated.
So it's not the kind of thing that's sort of like change, like once it's there, it's just there. Like
right.
Right.
It's not something you're like, oh, I feel like wearing a blue one today, like let me change it out. No, it's definitely more of like a permanent, it's a treatment for your migraines. Yeah.
So based on some of the principles that we outlined about it being difficult to remove yourself, painful to remove, you'd be nervous to remove it because of the pain you'd be in if you didn't remove it, and its permanence certainly sounds like there's basis for leniency. I would definitely say that, someone who has a situation should discuss it with, a case-specific question with a professional, but hopefully now you're armed with some of the issues that are important to bring up and information to share. But, ask the question in the best way possible. So thank you so much, Dr. Hellman, for joining me tonight and outlining some of these issues. Thanks to everyone for watching. And we look forward to having an opportunity to learn together with you again soon. Great night.
Great. Thank you.
Bye-bye.
All right. Bye-bye.